A chance to get the hard-to-find H1N1 vaccine produced a polite stampede of parents and not-so-happy children in Fairfax, Virginia this morning.
Oh yeah, it's definitely hard to get. It's the only place you can find it right now.
Whole families skipped Saturday morning cartoons and braved the rain and the line to snap up 12,000 doses of the drug.
No, I don't have the shot, but he has the shot, and I feel a lot better. That's why I waited in a line for 5 hours.
5 hours?
5 hours.
Many clinics, like this one, limited their supply to those most at risk: babies, young children, and pregnant women. The virus is not so selective. The Centers for Disease Control says H1N1 has spread to 46 states. More than 1,000 Americans have died, and more than 20,000 have been hospitalized. Experts say it will likely spread further. So much like a disaster declaration before a hurricane, the president today declared the swine flu a national emergency. The White House says it's not meant to scare anyone. It simply loosens some bureaucratic red tape to make it easier for hospitals to get what they need should the epidemic get worse. And health officials have now given doctors easier access to a new weapon against H1N1, an experimental drug called Paramivir, made by BioCryst Pharmaceuticals.
It's highly potent on the H1N1 virus. There were laboratory tests conducted by the CDC that showed that it's the most potent inhibitor of the H1N1 virus.
But the drug hasn't gone through all the necessary and time-consuming trials yet. So the FDA issued an emergency authorization to allow doctors to give the drug to the most seriously ill, those who aren't able to swallow Tamiflu or benefit from Relenza, which is usually inhaled. Paramivir, also an antiviral, is given intravenously. CBS News found 8 patients who were deathly ill but survived after being given the drug as a last resort, like 51-year-old John Boudreau. He got so sick in late August that he doesn't even remember spending the entire month of September in the hospital.
I am a lucky son of a gun to be here, no question about it.
Delays in producing the H1 vaccine means some of the children we saw getting shots today may have trouble getting the recommended second shot a few weeks from now. The White House said there'd be 120 million doses of the vaccine available by this fall. They've cut that prediction to 50 million doses they hope to have ready by mid-November. Jeff?
All right, Kimberly Dozier in Washington tonight. Kimberly, thank you. For more perspective now on the flu emergency, we are joined by our own Dr. Jennifer Ashton. Doctor, always good to see you.
You too, Jeff.
Let's start what this means in practical terms for doctors like you.
Well, it's really a preemptive measure, Jeff, so that hospitals can reshuffle their resources and modify their existing rules and regulations. So, for example, it enables them, if needed, to transport patients off-site to alternative locations if they become inundated, let's say, with flu patients. And it also enables them to hasten the process by which they take care of critically ill, potentially flu patients, and do away with some of the information and privacy issues that they normally are forced to abide by.
Let's talk about where the vaccine is being handed out, because in some cases, some of these places are now limiting the vaccine to children under the age of 4. How serious a problem is that for the kids who won't get it?
Well, potentially it is a serious issue, Jeff. We know that the H1N1 virus has a propensity to really attack young people, and that's young children as well as teenagers. And the CDC has outlined as a priority group for receiving the vaccine children ranging in age from 6 months to 24 years of age. So at this point, they have not yet said that it should only be children under 4. So potentially for all those older children, it could be a real issue.
Okay, now for those who don't know, when is the height of flu season? I guess they're different for seasonal and H1N1, and will there be enough vaccine by that time?
Well, it's a very important question. For the traditional seasonal flu, usually January to February is when we see the peak, as we call it, of the regular flu season. For swine flu or H1N1, which started in April, we're seeing the peak numbers actually right now in terms of 46 states in the country reporting widespread activity. The key point here, Jeff, is we don't know what the future will bring in terms of H1N1 cases, and that is largely why the president took this preparative step to declare this national emergency.
Basically, the earlier we get the vaccines, the better.
Absolutely.
Okay, Dr. Jennifer Ashton, thank you so much tonight.